Hey everybody, Dr. Keith here. In today's video, I want to share with you a different way of looking at health that is based in truth and what I see in my practice on a daily basis. And just give you a glimpse behind the curtain of the wonderful Wizard of Oz of what actually goes on when healing takes place and how healing can take place instantaneously and how our emotions can play into how well we're feeling, or it can make us actually sick. So I want to go over a case with you just to give you a glimpse of that. But before, let me lay some of the background work. The body works in a predictable manner. We get sick and have health issues in a predictable manner. There's a cascade of events that goes on. So if this is true, then there is a process and a priority of how we get the body better and healing. So stress is the cause of all health issues and disease, and M.E.N is the cause of all stress. M.E.N, mechanical stress, emotional stress, and nutritional stress. So let's look at this patient and give you a case history and give you a different way of looking at how the body actually functions. So this patient came in to me on a Tuesday morning, and she comes in and she's like, I just feel awful. I'm like, okay, explain to me what happened. Well, on Friday night, I ate dinner, and shortly after I ate dinner, I threw it all up. I started to get body aches, chills, no fever, and just started to really feel bad Friday night. So this was like 5 days ago. She goes to sleep, she wakes up, she doesn't feel any better. Her stomach hurts, she starts to develop a cough, just seems like she's coming down with something. So she goes to urgent care, they diagnose her with bronchitis, they give her an inhaler and send her on her way. Well, Sunday comes, not any better. No appetite, barely eating, still feels the same, just very low energy. Monday comes, no change at all. She comes in Tuesday, she's like, I just feel awful. I'm like, okay, well, let's run through and see what happened. Well, M.E.N, right? Mechanical, emotional, nutritional. Is there anything mechanically that has happened in the last week or so? Did you lift something heavy? Did you move something? Did you trip and fall? Did you physically injure yourself? No. Okay. Nutritionally, have you changed anything in your diet dramatically? No, I've barely been eating. Nothing has changed there. Then what else does it have to be? It has to be emotional. So I'm like, well, what's going on emotionally with you? She's like, there's not really anything going on that I can think of. I'm like, okay. So I lay her down on the table and I assess her to see kind of what's going on with her body. And she also stated that she was very nauseated or had nausea. So I'm like, all right, so I know nausea as related to kidney stress. And when people get sick, we have three main filters in the body. We have our liver, our kidney, and our spleen. So before I even treat her or adjust her or do anything, I'm just trying to assess to see where the stress is at in her body. So I hit her liver stress point, and that was completely soft and nothing there. I touch her kidney stress point, and they are very tender to the touch. I go to hit her spleen stress point, and I barely touch it, and she like jumps, like, whoa. So I'm like, all right, well, we found something. So I proceeded to adjust her, and then I flip her back over on her back, and I do some myofascial work in her arms and her legs to help minimize the stress on her nervous system. And I'm just sitting there talking to her. It's like, so nothing has happened emotionally in the last week or so. And she's sitting there, she's thinking, oh, one of my family members went into the hospital, and I'm very worried and concerned about her. So is an older mother-in-law that went into the hospital. She's 93, and she's very worried that she may not come out, because you hear all these stories about people her age going to the hospital and not coming out. So I'm like, okay, there's something. So she proceeds to have an emotional release, and she starts to cry. I'm like, all right, There it is. There's that emotional stress. So I continue to work on her and check her stress points when we're done. This time when I hit her spleen stress point, it is completely gone and soft. I can actually touch it firmly without her jumping. Her kidneys were still a little bit stressed, but everything else is pretty much gone and she's back to normal. She gets up off the table and she's like, my stomach pain is gone. Wait a minute, I'm hungry. I need to go eat something. Wait, I'm starving. I need to go eat like now. So when you find the source of stress, when you support normal function in the body can heal instantaneously like that. Her appetite came back immediately right then and there. That's how you know that you got the right thing. So let's kind of dissect this a little bit and give you a different way of looking at this. So if somebody came into my office with a cough, fatigue, body aches, vomiting, right? You're thinking stomach bug, something's going on. She's got some sort of an infection, right? Bacterial or viral thing, yes, right? But what if that wasn't the case? What if her emotions were the ones that were weakening those organs that then stressed out her nervous system and caused subluxations in her spine that then proceeded to make her feel awful? So let's look at this. From an acupuncture perspective, there are certain emotions that are attached to certain organs. So if somebody is frustrated or angry or just irritated, what organ does that affect? It affects the liver and the gallbladder. What about the lungs? What emotion attaches to the lungs and affects the lungs? Grief, sadness, right? So this patient was actually feeling that with her mother-in-law being in the hospital. She also mentioned that she was fearful and she was worried. What organs does the emotion worry affect? Stomach, spleen. And then fear has to deal with the kidneys. So what if all these emotions that she is feeling weaken those organs? She was presenting with these types of symptoms, and to heal that, we just had to acknowledge what the emotion was, get her to release it and acknowledge it, and boom, then her nervous system is like, all right, I got this now. I can handle this. And it goes back to functioning normally. This is kind of what I deal with on a daily basis in my practice. There is, like I said, M.E.N is the cause of all stress, and stress is the cause of all disease. So to give you an idea, people that come into my office that have purely a mechanical stress that is primary cause of their health issue is very, very low. We're talking like maybe 10% of patients that come in. The nutritional component is anywhere between 5 to 10%. The emotional component is anywhere between 80 to 85% of what walks through my door. And this is what I look for, and this is where the healing actually takes place. Because if you're not addressing that emotional component, then you're not healing anybody. All you're doing is managing symptoms. So when we're looking at this, when people come to see me, I am treating two things. I am treating the physical manifestation of their issue, which is the effect. And at the same time, we have to go after the cause of what's causing those issues. And we have to treat that in order for the body to heal. So I hope this kind of gives you a different perspective on how the body works, of what I do in my practice. There's a couple other videos I have linked down below to some other different things of concepts like this. So take a look at those. Make sure you hit the like and the subscribe button so you can stay updated to all my future videos. So thank you much for watching. I'm Dr. Keith. We'll see you next time.